Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We're hosting press briefings in Itasca County every other Thursday to address COVID-19 related issues and questions. And today we will discuss vaccinations in Itasca County. Our speakers will include Alicia Alleman, Nurse Manager for Scenic Rivers, Dr. Jeff Scrivener, Medical Director of Scenic Rivers, Sam Dwyer, Acute Care Pharmacist, Essentia River, John Pedersen, Interim Vice President of Operations, Grand Itasca Clinic and Hospital, and Renee Bymark, Executive Director for Elder Circle. We are very excited to be less than a year into this pandemic and have vaccinations available to us. However, they are arriving in Minnesota and Itasca County in limited amounts, and they're being distributed to certain priority groups, including healthcare, EMS, schools, childcares, and persons 65 and older. Because vaccines are not readily available to the public at large, we have to do the things we know that slow the spread, including masking, staying at least 6 feet apart, and not gathering in groups. We continue to see less cases in Itasca than we had in September, October, and November. We did a lot of work over the holidays to get our numbers down. Our community made sacrifices. We didn't see our family and friends like we normally would do, and we don't want to lose that ground we've gained. We have to stay strong until vaccines are available to the broader public and until enough people receive it to reach herd immunity. Itasca County collectively has reached 15.9% of the population to begin the vaccine series. This has been a collaborative effort with our local hospitals, clinics, pharmacies, including our neighboring groups of Fairview Range and Leech Lake Indian Health Services, and us in public health as well. We've reached most of our phase 1A healthcare staff, although a few continue to be identified and vaccinated as we move forward. After next week's clinics, all school staff who identified themselves to be vaccinated have been offered an opportunity to sign up for dose 1, and some have actually even received dose 2 at this time. We're working on any DHS licensed facilities, including foster care providers, group homes, treatment facilities, both staff and residents, and will mostly have been offered dose 1 to those in Itasca County by next week. Our skilled nursing facilities have mostly received 2 doses, and our assisted livings as of next week will also have been offered 2 doses of the vaccine. Because we've been reaching our priority groups, we have been able to offer a very limited amount of vaccines to our 65 and older population. That's in Itasca County Public Health specifically. We had 260 doses available, which was supposed to be given this week and ended up being moved to next week because we have some shipment delays, and these appointments have filled up already. Scenic Rivers, Big Fork Valley, Essentia Health, Thrifty White, and Walmart have all been able to offer a limited amount of vaccines to our 65 and older, and again, that is with limited supplies. You can register online at Thrifty White and Walmart when their doses are made available. And I will let the clinics and hospitals speak specifically to their processes when they are up in the agenda. Grand Itasca Clinic and Hospital has some limited supplies available for their 75 plus, and they will be on to speak to that today as well. There continues to be a statewide lottery system available, which you can register for online at mn.gov/COVID-19/vaccine/find. And I did put that link in the chat for our media partners so they can share that. The lottery has been reopened. Our great community partner, Elder Circle, will assist our seniors with registration on any of these online systems, and we're happy to have their executive director today to speak to what they can assist with. In Itasca County alone, we have between 12 and 13,000 persons 65 and older, and it will take some time to get these groups vaccinated, and we appreciate everyone's patience as we move through this process together. At this time, we do not know who will be next in the priority list identified by Minnesota, beyond our healthcare, schools, childcare, and 65 plus. But when we are offered that information, we will certainly share it. We'll share it in our weekly media releases and also on these press briefings. We are experiencing some shipping delays this week in Minnesota due to weather concerns in other areas of the country. However, for the most part, dose 2s have still been following dose 1s. We understand there's been some media coverage on this, and we are monitoring if there are effects in our communities on this. But as of right now, this hasn't broadly been the case. As healthcare in Itasca, are encouraging all of you who are waiting your turn for the vaccine to do your research now. And please, when you're doing your research, use your healthcare website, use the CDC, use the Minnesota Department of Health to do your research on the vaccine. It is very much a personal choice to receive vaccines, and we hope that when it is your turn, you will be ready to make that decision. The vaccines available to us on Pfizer thus far with 2 doses are 94.5 and 95% effective over severe illness and death. The vaccines work to activate your immune system to recognize the spike protein on the surface of the corona and fight it off. Because your immune system is activated, sometimes people will feel effects of fatigue, chills, sore arm, achiness, but this means the vaccine is working. And we encourage folks to expect to feel something the day after receiving the vaccine and just to relax, use ibuprofen, Tylenol for any achiness, and know you will feel better soon. Of course, any side effects that last longer than 3 days should be addressed by your primary care provider. There has been some media coverage on not having adequate staff to inject vaccines off and on throughout Minnesota. We in Itasca County Public Health have brought on over 10 healthcare persons to inject or otherwise volunteer in our clinics. We likely will bring on more in the near future, and we're so appreciative of those who have expressed a desire to be a part of this pandemic solution and move the vaccination forward. We're appreciative of Elder Circle with their willingness to assist with online registrations, and we are exploring other volunteer opportunities with United Way of 1,000 Lakes on other needs we may have as we move through this vaccination process. Before I introduce our first speaker, I will provide a quick situational update on cases in Itasca County. We've identified 32 new cases in the past 7 days, 90 in the past 14, and our cumulative total since March of 2020 is 3,033. We've had 45 deaths. Hospitalizations locally and regionally have decreased from COVID, and we continue to thank our Itasca County community for staying strong, staying the course, avoiding the gatherings, staying 6 feet apart from others, and wearing their masks. I will now introduce Alicia Alleman, Nurse Manager, Scenic Rivers Health Services.
Thanks, Kelly. So Scenic Rivers Health Services is currently scheduling appointments at our medical clinics for patients 65 and older. We do have the Moderna vaccine. Appointments are limited according to vaccine supply, and we too have experienced some shipment delays, though at this point we're not having to reschedule anybody in the beginning of next week anyway. So you can call our Big Fork clinics or our Cook clinics, and we'll get you in as we have vaccine available. Supplies are limited and the call volume is very high though, so please be patient when you're calling. To date, Scenic Rivers Clinic in Big Fork has completed over 1,000 vaccines and close to 3,000 organizationally. We have clinics in Cook, Tower, Floodwood, Big Falls, North Home, and Big Fork. And we continue to follow guidance for community health centers set forth by MDH. We're very excited to be able to offer vaccines and to help fight the pandemic. And we also would remind people that it's important to continue to wear a mask and to social distance and frequent hand washing, and just to do your best to stay healthy altogether. If you have any questions, you can certainly visit our website or give us a call. Thanks.
Thank you. And I will now introduce Sam Dwyer, acute care pharmacist, Essentia Health, Deer River.
Thank you, Kelly. Good morning, everyone. This is Sam from Essentia Health, Deer River. Through Tuesday, February 16th, we have administered over 1,300 doses of the COVID-19 vaccine, including over 1,000 first doses and close to 300 second doses. This week, we'll administer an additional 288 doses. And while we can't wait to ramp up our vaccination efforts and immunize even more people in our community against this virus, supplies are currently limited. Consequently, our current focus is on providing second doses. The CDC recommends a second dose be given within 42 days of the first. We hope to resume providing first doses in the near future, depending on our allocation from the state of Minnesota. We are following guidance from the Minnesota Department of Health, which determines vaccine priority, and we continue to vaccinate those in phase 1A, as well as individuals aged 65 and older. We are committed to safely and efficiently vaccinate as many people as possible throughout Itasca County with a strong partnership in public health. We are currently vaccinating Monday through Friday from 8 a.m. to 4:30 p.m. If anyone would like to be added to our wait list, we encourage you to call our clinic directly and know that please be patient. We are scheduling based upon our allocation. And we thank you all for listening to this call today, and we'll accept questions later. Thank you.
Thank you. And we will now hear from John Pedersen, Interim Vice President of Operations, Grand Itasca Clinic and Hospital.
Yeah, thanks, Kelly. So Grand Itasca, we've been planning for vaccinations for months, and we started giving our first vaccines the week of 12/21. First 6 weeks were dedicated to healthcare workers, and we received our first vaccination for patients the week of February 1st. And to date, we've given 2,100 shots. Currently, we are vaccinating patients 75 and older. We're focusing on this age population because we know they're at the most risk for serious illness, including death, should they contract the virus. And 30% of this patient population actively uses our Epic MyChart. And so, we're actively working with groups to understand how we can reach out to this population and make sure that they don't go underserved. Right now, we're doing about 300 first doses per week. And next week, we'll start doing 300 first doses and second doses. So a total of 600. Appointments can be made by calling our appointment line or reaching out and using MyChart application. More information is available on our website on how you utilize that. We open our vaccine schedule weekly at 9 a.m. For the upcoming appointments. Obviously, the demand's been very high for the vaccine, and the supply to date has been limited. So we've stressed our phone system. We know we get about 1,000 calls in the first minute, and we just encourage people to keep trying, and we appreciate your patience. The supply is hopefully going to go up. We're encouraged by news from the state and the vendors that they're able to increase their allocations coming up in the future. So we're hopeful for that. Right now, we get our weekly allocation notice on Thursday mornings, and that'll let us, project out what we're going to be able to do for first doses in the upcoming week. And we're hoping that those obviously grow in the future. So thank you.
Thanks. And we will now hear from Dr. Jeff Scrivener, Medical Director, Scenic Rivers, on some of the medical effects we're seeing from the vaccine.
You won't hear from me unless I unmute. Okay. Well, I've been pleasantly surprised with the lack of volume of side effects. I've talked to a lot of people who've received their vaccinations, and primarily everybody gets a sore arm. Some people have had fever. We've had very few severe reactions. There have been a couple people I've had to advise not to get a second immunization because of their response. But of course, the biggest concern we have with the vaccine, and based on history, is whether or not you might experience an anaphylactic reaction or a systemic allergic reaction to the vaccine. And that, fortunately for our organization, hasn't occurred. We talk to people and we try to seriously screen people beforehand and make sure that they're not at high risk. And if we identify them as high risk, then I've had to refer a couple of people to allergy for recommendations about whether or not they can safely receive the vaccine. And we've had to submit some questions to the state health department and even to the CDC directly that the state couldn't answer regarding vaccine and potential allergy. But overall, this is a well-tolerated vaccine. It's highly effective. It's there have been, as you know, nationally, millions of vaccinations given at this point, and we're not identifying any secondary side effects that weren't identified in the first trials. And so if people are adequately being screened and answering those questions honestly about prior allergy history, I think that this is a very safe vaccine rollout. Our biggest problem is vaccine supply, as people have indicated, and then the resources to administer that vaccine in a safe and consistent fashion. So I think that, at least it's been our experience, there has been minimal difficulty with side effects. And one thing to remember, as was suggested earlier, if you have symptoms you think are related to the vaccine more than 72 hours, 48 to 72 hours after you receive vaccine, then you may have another source of those symptoms, and you should check with your medical provider as you may actually have COVID. I mean, that can happen. It could be that you got exposed before you got the shot. And so if you're having symptoms, especially fever, beyond 72 hours after vaccine, then you need to have that evaluated.
Thank you. And we will now hear from Renee Bymark, Executive Director, Elder Circle.
Thank you so much for having us today. Elder Circle stays committed to supporting older adults in Itasca County, especially during COVID pandemic right now. We're supporting older adults who do not have access to internet or a computer or email access. So if they need assistance in registering for a vaccine, they can call our number at 218-999-9233. And we really ask those who do have their own access to attempt to register first on their own. If they still need assistance, to then call. We want to really focus on those older adults who do not have the access to internet. And we're continuing to send out communications weekly on any vaccination clinics that we're aware of. And you'll find this information on Facebook, and we send it through our eBlast platform. So we also welcome any healthcare systems or pharmacies who want to get that information out. To feel free to let us know, and we'll include that in our eBlast on a weekly basis. And we continue to support anyone who might need help with that registration, because we know it can be very challenging for older adults. We also know that as this last process that we did, we saw that if you were trying to do it on a phone, or if you were trying to do it on an iPad, you were not seeing the full registration. And so if you don't have a full laptop, that can be very challenging. So we just appreciate the opportunity to be able to support older adults right now. Thank you.
Thank you. And I can speak honestly from public health. We were very successful in using Elder Circle, and we're so appreciative. Definitely helps with our volume of calls and emails coming in. So thank you. We will now move to our question and answer portion of the press briefing. And we, as always, ask our media to identify themselves with your name and the organization you represent. And our panelists will answer as we move forward. So we have our first question, Kathy Lynn, KOZY, are local clinics using just Moderna? If Johnson & Johnson becomes available, will that be used locally too? I'll just start with public health and then move on to the clinics. We have only received Moderna thus far, although we have been told to prepare ourselves to receive Pfizer. We just haven't received it yet, but we have our standing orders and we have all the protocols already in place, just waiting if that's the vaccine we receive. And if Johnson & Johnson becomes available, will we use it? Absolutely, we will use the vaccine we received regardless of which type of vaccine it is. And we'll hear from all the clinics. John, do you want to start?
Sure. John from Grand Itasca. So we have used only the Pfizer vaccine, and the Pfizer vaccine comes with those hurdles of having to be in ultra cold, minus 60 to minus 80 degrees. So we're lucky to work with a hub that has that access, and we have that access now at our facility as well. We're hoping and we're willing to use whatever vaccine we get. Moderna, as Kelly's mentioned, has been allocated to some sites across the region. I think the Johnson & Johnson emergency use authorization trials or sessions start February 26th. So we're hopeful that they will be able to get approved and push through with their 100 million doses within the first 2 quarters. I think that would be extremely encouraging for rural America to get those doses.
Thanks. And Sam, would you like to speak on behalf of Essentia?
Yep. Sam here for Essentia Health. We are also currently vaccinating with Pfizer only at this time. Similar to, as you all have stated, we are willing to accept any drug manufacturer's vaccine, whether that's Moderna, Johnson & Johnson, or if we continue to receive Pfizer. So we will, whatever we receive, we will make sure it's available to the public as soon as possible.
And Alicia, Scenic Rivers.
Hi there. We are currently using only Moderna. But again, as everybody said, I imagine we'll take whatever we're given and we'll make that work.
Thanks. And I cannot speak completely on what the pharmacies have received. I believe it's Moderna mostly, but not fully sure. And I know Big Fork Valley has assisted us with Pfizer with our phase 1As and some of our school staff, and we've been very appreciative of their support. Other questions? Jennifer, ICTV, would you encourage students to travel to Duluth or the Twin Cities if they are available? Collectively, as healthcares and pharmacies, we've been meeting in Itasca County weekly to touch base and find out where everyone's at with previous doses given and doses moving forward. And the general consensus right now is if you are offered a vaccine and you have the ability to go get it wherever you can go. Supplies, they've been coming in slow and steady, but that doesn't mean that we're always receiving the same allocation. I know for us personally, our allocation for next week is much lower than it's been probably for the past few weeks. So we would say if you are on a list and you get called, take advantage of the opportunity. Other questions? Okay, seeing none, we will end a little early. Thank you so much. Stay strong, and we're so happy to have all of your support. Thank you.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.